This is going to be a very short video just about enrolling in Medicare. Now, when I speak to folks, they're usually in one of three situations. That's going to be scenario one, where you are currently receiving Social Security benefits, which means you actually don't need to do anything. Your card is going to arrive 3 to 4 months before your birthday month. And then it's going to say part A and part B on it. Then your job, your action, if you are in scenario one, is to start doing the research on which plan you want to go with, Medicare Advantage plan or Medicare Supplement plan. Scenario number two is going to be you're not taking your Social Security. Maybe you're someone who says, Alyssa, I'm going to wait till full retirement age. This is your scenario number two. Your action is going to be to go online, call Social Security, or go in person to Social Security. And that online website is ssa.gov. You'll create your account. You will have to manually apply for Part A and Part B. So, in three methods: online, by phone, or in person. After you are done completing your application, 2 to 3 weeks later, you will get mailed to you the red, white, and blue card. Scenario number three is going to be maybe you're currently working and you've got group insurance from your employer, and you are kind of, maybe bouncing around the thought of keeping your group insurance, or maybe you're trying to figure out if Medicare has the better offer for you. That should be your action, should be comparing your group insurance to Medicare. Now, how do you do that? There's three numbers that you would want to look at: the cost of your group insurance, the deductible, and the max out of pocket. You go and compare those three numbers to what Medicare can offer you. And as long as you are working for an employer who you are receiving their group health insurance, they have 20 plus employees. Okay, that is very important because that's what makes your health insurance credible. So if you say, I'm really getting a good deal with my group insurance, do I have to enroll in Medicare? The answer is no. Am I going to be penalized if I don't roll in Medicare? The answer is no, again, because you've got credible insurance. If those things you aren't checking the box on those questions that I just asked a little bit ago, then you better enroll in Medicare because your coverage is not credible and you will be penalized. Okay, so here it is, a breakdown. Scenario number one. Again, you are, oh man, let's go back. Okay. This is going to be a short video about enrolling in Medicare. Now, the folks that I speak of are usually falling in one of these three categories. Scenario number one, you're receiving your Social Security. Scenario number two, you are not receiving your Social Security. And scenario number three would be you are still working. So let's break them down. Scenario number one, you are receiving your Social Security. Your action is to do nothing and check your mail. Okay, because your card is going to arrive by mail usually 3 to 4 months before your Medicare starts. So the usually the first of your birthday month is going to be when your Medicare starts. And your Part B premium is going to be automatically withdrawn from your Social Security check. So your action, again, check your mail, and then also be doing the research on, okay, after A and B, are you going to replace A and B with an Advantage plan, or are you going to add a Medicare supplement? That should be your next step. Scenario number two is you are not receiving your Social Security. You are the person that says, Alyssa, yeah, I'm going to wait till my full retirement age. I don't want to, draw from my Social Security at this point for whatever reason. Okay, whatever reason it may be. This means you have to manually enroll in Parts A and B, either by going online, ssa.gov, calling Social Security, make an appointment, do the application over the phone, or do it in person at your local office. Now, this is very important because sometimes people get sticker shock. They say, Alyssa, what do I have this $600 bill or this, a higher bill from Medicare and what's going on? That's because you aren't taking your Social Security, so they are direct billing you. Now, it's supposed to be quarterly, three, in which 3 times 202.90 is 608.70. Sometimes they will bill 4 months at a time. Sometimes I've seen five, I've even seen six, y'all. So be prepared, okay? That they will direct bill you if you are not taking your Social Security and you plan to enroll in Medicare. Scenario number three is very common. A lot of people are going to continue to work past their Medicare age. Okay, maybe retire at their full retirement age, 67. Some folks like my father continue to work even till he's 70. So if you are currently working for an employer, okay, y'all, all of these boxes have to be checked. If you are currently working for an employer that has 20 plus employees on the payroll, you are receiving their group insurance plan. Okay, that means that you have credible insurance in the eyes of Medicare, in which your action at this point is to pump the brakes and compare your group insurance to Medicare to see which is going to give you the most bang for your buck. And here's how you do it with three numbers: the cost. What are you paying for your group insurance? Okay. The deductible. How much of how much do you need to pull out of your pocket before you are privy to the negotiated rates, which are called like the copays? Okay. The deductible. And this is all on your insurance card, not the cost, but the deductible and the max out of pocket are usually on your insurance card. Okay. Max out of pocket. So it's usually going to be a deductible, anywhere between zero to I've seen $5,000 for those high deductible health plans. Max out of pocket, usually anywhere between three to seven to $9,000 max out of pocket. So those are what the numbers kind of look like. So you will compare those three numbers to what Medicare can give you, and then may the best man win. Okay. Because if it's Medicare, you can continue to work and earn your full income and be on Medicare and not take Social Security. That you can do that, okay? There's plenty of folks that I help that they are just going to get either A, better coverage, or B, a better cost by moving their health insurance to Medicare, okay? Or both of those things can be true at the same time. Then there are some folks who are getting a better rate with their group insurance. Maybe their family's still on their group insurance, okay, in which they need to stay in their group lane and keep that and just delay Medicare. When that happens and your coverage is credible, you do not get penalized. Okay. Quick thing about this: if you have an HSA and you're like, oh, I better enroll in Medicare. I better at least get Part A. Do not do that. If you are actively contribute to an HSA, do not enroll in any part of Medicare. You must stop that if you're wanting to enroll in Medicare. Or there are tax implications. Now, when you do enroll in Medicare, your coverage will start the first day of your birthday month. So I'm born on September 16th. My Medicare will start September 1st of my 65th year. Okay. So, first day of your birthday month. And that's all for this video.